want to call to order our Human Relations and Agents Committee meeting this morning. I want to welcome each and everyone here. We do have our registry. I will ask you again this morning to at least sign in. If we already have your information on file, you don't have to repeat by writing it again, but if anyone is new here for the first time, please make sure that we have your information so that we can have your email and communicate with you between our meeting times. This morning, I'm glad to have our committee members here. We have several items that will be up for discussion. It was announced initially that we would be doing House Bill 278. Late yesterday afternoon, after meeting with quite a few individuals, we are working on a substitute to that piece of legislation. So the bill will not be heard this morning, but we will bring it back before the full committee, and at that time you will have an opportunity to speak up on it. But in the meantime, if you have some concerns and you want to let those issues be known, try to see the primary author of the bill. Discuss your issues with him, since we are doing a substitute to the Health Care Directive Act, and looking at what is the best way to resolve some of the solutions that we see out there that are existing. So let each of you know, and those that may not be here, that the door is open for discussion to see what we may come out with a substitute that will be coming to the committee at a later date. So thank you for your understanding with that. Also today on our agenda, I had spoken with our new director of the Aging Services within the Department of Human Services. We've got several individuals with us this morning, and I'm going to ask our legislative liaison, Doris Canton, if she will come forward and introduce herself and those that are here from the department, and introduce our director to our committee. Recorded.
Thank you. Madam Chairman, members of the Human Relations and Aging Committee, my name is Doris M. Clanton. I'm Legal Services Officer with the Georgia Department of Human Services Division of Aging Services. It is my pleasure to introduce you to, first of all, to Lisa Marie Shekel, who is our new Director of Legislative Affairs and Communications for the Department of Human Services. And along with her, your speaker of today is Jay Bulott. It's Dr. James J. Bulott, and he is our Division Director for the Division of Aging Services at DHS.
Thank you. Welcome to each of you three for being here this morning. I appreciate you coming to bring information to us, to let us know who you are face to face rather than through a letter of communication, and be able to share with us what you do and how you can help us benefit in this committee. With that,
I'll get started. I had a PowerPoint, but as a long-time teacher, I brought paper backup just in case. And what I'm going to provide for you real briefly, or as briefly as I can, is a short overview of what the Division of Aging Services does in the state of Georgia, how we're structured, and what falls under our purview as far as programs are being administered. I think being passed out right now is a copy of the presentation that I had. The Division of Aging Services is the state unit on aging designated by we'll never have enough funding and enough resources, enough human resources to provide all the services that are needed. Those partnerships are essential for how we do business, whether it's at the local level with the nonprofit organizations, whether it's at the regional level with regional commissions, or whether it's at the state level with the other departments in Georgia. We work a lot with DBHPD, we work a lot with DCH, and a lot with DCA on coordinating services for older adults. I'm going to quickly go into Adult Protective Services. This is our largest state-funded program. It is the only program that we directly administer, and that's one of those public safety programs that you really don't want to contract out for those services. We have seen, on average, a 24% increase in adult and youth neglect exploitation calls over the past year, and that's primarily due to two factors. One of them is the aging of the population in Georgia. Georgia is one of the fastest aging states in the country, and it's also due to the economic climate that we're in. So we're seeing, in addition to the normal increase that we see due to demographic aging, we're seeing an additional increase in financial exploitation, theft with older adults, and that's where our office comes into play to help protect the assets and the health and welfare of older adults and disabled individuals over the age of 18. APS also administers guardianship on behalf of the state and on behalf of Human Services, and those are individuals who have been determined by the court unable to make decisions. We are considered the guardian of last resort. Although whenever possible, we try to get more appropriate guardian and family members loved ones. Our second largest funded program is a community care services program. That's the Medicaid waiver program. And it provides a larger array of home and community-based services for older adults who need nursing home level of care. And that is a key term that we use throughout aging services, nursing home level of care. Is about anywhere between 11,000 to 13,000 individuals receiving a Medicaid waiver. And we are successful at keeping individuals at home on average of about 51 months from the point in which they come on to services. And these are individuals who, when they came into our services, were eligible and may have gone into a nursing home or some other institutional setting. It is one of probably our most successful programs as far as customer satisfaction as well. We have upwards of 90%, 95% customer satisfaction in that particular program. And you can see on slide 8 is some of the programs, some of the more successful or more popular programs of which consumers benefit. Slide 9 is a non-Medicaid program. This program serves anywhere from 26,000 to 36,000 individuals every year at an average cost of about $1,500 per person. The CCSP, the Medicaid waiver, the average cost of that particular program is about $12,000 to $13,000 a year, based on the level of need in which an individual has. So you can see we're able to stretch a dollar extraordinarily long in aging services. Our success rate on keeping individuals in the community in the non-Medicaid program, and these are individuals who also meet nursing home level of care, although they may have some income requirements that don't qualify them for the Medicaid program, is right at about 41 months at the point at which they come onto our services. Again, that program is very successful. Probably has a waiting list close to about 21,000 individuals waiting for those services, and primarily because it's one of those non-means tested programs, so you don't have to meet a particular income requirement to qualify for the programs. We look at most social and economic need, but not necessarily the most economic need. So if you're an isolated person at risk for abuse, neglect, exploitation, not socializing very, very much, you may qualify for one of our services, assuming there's nobody who has a higher degree of severity on the waiting list. Slide 10 is a senior community service employment program. Again, one of these areas where we really have to partner with other agencies. And on this particular program, we partner with the Department of Labor. This is our senior employment program for older adults over the age of 55. We provide, and we, meaning our contractors and subcontractors, provide training, coaching, job coaching, and subsidized employment for a very short amount of time until they have the skills that they need to assume full-time employment by the employer. We have roughly about a 78 to 80% retention rate in that particular employment program that we administer. And we work very closely with the Department of Labor, the Workforce Investment Boards, to ensure that people are getting referred to the appropriate programs. Our office also has a big health and wellness focus to it. So not only do we provide services to individuals who meet nursing home level of care, but we also try to prevent the need for additional care. And we do that through nutrition counseling and physical fitness programs. And many of you, if you visited your senior centers or your community centers that are dual focus, you've seen some of this. Medication management is a very popular program that seniors benefit from greatly. Some of the areas that we've seen a lot of successes in the falls prevention over the last year. The first Falls Prevention Coalition formed with a partnership between Division of Aging Services and Public Health and DCH. We provide foot care, weight control, disease management, and immunizations. One of the focuses for our office over the past year has been an emphasis on evidence-based programming. And what that means is, if a program is administered in a particular way, we know the outcomes we're going to get. We've come to the conclusion that we can't just throw money at things and hope that we're going to see the outcomes. We want to make sure that we're investing in outcomes. Elder abuse prevention is a flip side of the Elder Abuse Protective Services program, Adult Protective Services program. Elder abuse prevention is where we provide the skills and outreach and resources to individuals to protect themselves from getting abused, neglected, and exploited. One of what I believe is one of our most important programs is the Long-Term Care Ombudsman program. We have one state long-term care ombudsman and about 5 staff people that coordinate over 300 volunteers and paid staff across the state who want state employees. They go to every nursing home at least once a month and every personal care home quarterly to talk to the residents in those facilities to make sure everything's okay, to make sure their rights are being protected. And when their issues arise, we work with the client and the owners of the facility to come to a resolution. Now, let me put that in perspective. We have over 350 nursing homes in the state of Georgia, and we have over 200,000 personal care homes. So we have one state long-term care ombudsman and about 300 paid and volunteer staff who are going out every month to each one of these facilities talking to everybody in there. Access to services. This is the umbrella for our Aging and Disability Resource Center. And you may have heard of the Aging and Disability Resource Center. You may not have. It's an area that we're putting a lot of resources into. Access to services also houses the Elderly Legal Assistance Program, Georgia Cares, and, as I mentioned, ADRCs. Slide 15 highlights a little bit on what the ELAP program does. And again, let me emphasize that this isn't done by state employees. This is done through our collaborations with. Yes.
I just wanted to open it for questions at this point from any of our committee members before we go into the next stage here if there's someone that would like to ask something. Representative Hinton.
Thank you, Madam Chairman. Doctor, a couple of questions. One was on the, I'm having to go back and find my slide now, that I don't remember whether it was you or one of your assistants that I talked with. I got a lot of emails concerning the changing of the definition or as to who could live in an assisted living home, and and I was wondering where that policy change is right now.
Well, that was in DCH, and I believe it's on hold for further review. And Lisa, you may have some more information on that. That's the level of care within the policies.
There were some proposed rule changes that DCH had presented in December, I believe it was, and it's my understanding at that time those rule changes had been tabled so they could have further conversations, but I certainly can get a message to the Department of Community Health to provide you with more information if you'd like.
Well, they called me and told me that it had been put on hold, that they had gotten quite a few phone calls about what was to me the key word in assisted living is assisted, and it seems that like they were going to change the definition, that if you had to have assistance, if something happened at the facility and you had to have assistance to get out, then you were going to have to move to a nursing home, and that was what was scaring a lot of people. The second thing is on the nursing homes, and you gave a figure of the total number of beds, the facilities. Is it state or federal that limits the number of facilities that we have?
Right now it is state. And in order for there to be a new nursing home, I believe there's a certificate of need process that an entity must apply for and show that there's need in that area for an additional facility. And that's regulated, I believe, by DCH, certificate of needs.
Now, have there been any CONs granted in the last 5 or 6 years? Can you tell me that?
Yeah, we'd have to talk to somebody at DCH about that.
All right.
I think there's been at least one in my area that has been added, a number of residents.
Do you one other question, if I
Please.
could? Do you find that where you have senior citizens that are being abused, it's where that the senior citizen is being cared for in the home instead of maybe in a nursing home setting or assisted living setting?
One of the fallacies behind adult abuse and neglect is the majority of it happens in a nursing home. And in reality, less than 5% of adult abuse actually happens in a facility. Over 90 to 95% of abuse happens in the home and in the community. And we have a number of programs. I'd be happy to come back and talk to you about some of our initiatives on preventing abuse and neglect and taking a public health approach to elder abuse. But that's one of those areas that I used to teach in long-term care administration, and I battle that stigma often, that most abuse happens in a nursing home. It's a public facility. There's a lot of staff in there. There's a lot of protections built into that structure. Whereas individuals in a home and in a community are isolated. They may not leave anymore. They may be have a disability that limits their ability to get out of the house. So, the key factor is you have to recognize abuse is happening to report it.
Okay. Thank you.
Going back to a question that Representative Benton had indicated, give us those numbers again to the number of nursing homes, assisted living homes that we have in our state.
And I'm going to be plus or minus 5%. There are approximately 2,000 personal care homes, licensed personal care homes in Georgia, and there are about 350 nursing homes in Georgia. I believe the number of beds within nursing homes is about 34,000 to 36,000 beds, and somewhere in the mid 40,000s for personal care homes.
Anyone else on our committee? Yes, please, Representative Scott.
On slide 9, non-Medicaid home and community-based services, you stated that you have a waiting list of 21,000 people waiting for services.
Yes.
So what are you all doing to try to provide services for these 21,000 people waiting to be served?
Well, as far as, for example, I'll use the home delivered meals program because that seems to be one that everybody's familiar with. In instances where it's an individual who's on a waiting list for a home delivered meal, what we try to do is if they have resources themselves, we try to connect them to a private pay option, or we have cost share that's available for individuals who are low income, but may not meet like the Medicaid level of need. We also provide, through the Age and Disability Resource Centers, access and referral to a lot of community-based resources that may be able to fund some of those needs for that individual. And that's part of where these partnerships are really important, because our budget for the non-Medicaid program is only about $22 million for the state, and that's again, and 98% of that's direct service funding. The other 2%, a little bit used to fund our office and the overhead for the area agencies on aging. So we try to provide some other resources when we don't have the monetary funding to provide direct services.
Any additional question, Representative Scott? Anyone, other member on our committee have a question before I let Representative Benton also ask some additional ones? Representative Benton.
Thank you, Madam Chairman. One further question. We have all these programs for people who are on Medicaid. Are there any programs out there for people who do not qualify for Medicaid that, for example, instead of putting a mother or father in the nursing home, the family decides that it would be better to try to keep them at home, which would be a cheaper, to me, would be a cheaper way to go. But are there any programs out there that those families can leverage into to try to help?
Of course, funding is always an issue, but every program outside of the CCSP program is eligible, is open to anybody regardless of income. One of the programs we have that's been very successful is the National Family Caregiver Support Program for individuals who choose to provide care to their, and it may be to a spouse, it could be a child providing care to a parent, to bring in those resources to help that person care for their loved ones in their home. And that's our preference. My staff here may say all the time, our goal is to keep adults at home in the community for as long as possible. Now, we recognize that there is a need at some point for a nursing home level of care, but when that's not the appropriate choice, we're going to make sure the resources, or at least the information is available to allow people to make the most appropriate decision.
Would it be possible for your office to send me some information on that?
We have
it there, okay?
Yep, we have it right here.
Thank you. Thank you, Madam Chair.
What I preferred to do was not give those packets out so that we would ask the questions and know if the information is in there without us thumbing through the literature at this point. And we certainly do want to get you to come back and talk with us again about the abuse programs and go into detail there. I have one question, too, regarding to the very last slide that you brought before us, the access to services. Tell us again where these services are. Particularly, I'm curious about the 3rd Aging and Disability Resource Centers, where they're located, and does all 159 counties throughout the state have such a program?
As of this year, now every county is covered by an Aging and Disability Resource Center. We provided, we were very creative in how we scrubbed our funding to make sure that every region had that coverage. And the ADRCs, and I want to make it clear that it's Division of Aging Services does aging, but we also do a lot of other things as well. I kind of joke that we're actually a division of Adult and Aging Services, because if you're over the age of 18, if you're disabled, we have APS. That's a program that you might. But now we also do the ADRCs, and we work a lot with the DD Council, the Independent Living Centers, to coordinate those services. They're in every region. Most of them are located or housed very near the regional commissions. It's one of those programs that they are allowed to house within their facility. To access it, you dial 866-55-AGING, no matter where you are in the state, and it'll get you to your appropriate Aging Disability Resource Center. And that is what we're using as our front door to entry into all of our services. So if you need legal assistance, if you want to know about the Ombudsman program, if you want to report adult abuse, neglect, exploitation, if you want to know about your Medicaid or Medicare and what part you need, part A, B, C, or D now, we'll provide all that information to you by dialing that number, and we'll connect you to a real person.
And that was
866-55-AGING. That's the very last slide. It has the 866-55-AGING number.
Okay. Any other questions so far through the slides that have been presented? Yes, Representative Bell.
Madam Chair, thanks for being here this morning. I really appreciate it and appreciate the information. Right now, here at the legislature, are there any particular bills that have been filed this particular session that your particular department is watching closely that you would want to bring to our attention?
We monitor almost any piece of legislation that has a potential to directly impact older adults. I know there's been a lot of discussion, and our office has been monitoring the tax restructure, because that has the potential to impact older adults. And Doris coordinates most of our legislative monitoring. You want to share any? I mean, that's the one that stands out in my head as one of those that might directly impact. The one Representative Benton was discussing, I believe, a level of care bill may be dropped regarding levels of care within assisted living or personal care homes. That's one, of course, we and most of the agencies that provide services to adults in the community are monitoring, because that has a big impact on our ability first to transition older adults out of nursing homes if they qualify to move out of a nursing home, or if they desire that, but also keeping people in the community as their needs increase. We've seen, I'm going to get on my academic bent, that personal care homes are starting to look a lot like nursing homes did about 20 or 30 years ago. Just the aging of the population, the chronic disease that the older population suffers from oftentimes. And that was what a nursing home looked like 20, 30 years ago. Personal care homes, they don't have the level of care that a nursing home does, but there are degrees within that services can be provided, I think, and we can safely keep people in the communities. So that's another one that we monitor. Our long-term care ombudsmen are also monitoring that particular bill, and oftentimes they're able to provide some direct commentary.
Thank you.
I don't believe that bill has been dropped yet, has it?
No, but we understand that there's been a lot of work. The various industry groups are working on that.
Have you been a part of that discussion from the department? If no other questions from our committee members, if you'll continue.
Okay. I am almost done. The ELAP program, as I mentioned, that's the legal assistance program, and so far this year, I just got the update, we've saved approximately $4 million in legal costs for older adults, and this is non-criminal. This is, and it's not trust, and it's not wills, and it's not anything else. It's issues with, like, for example, grandparents raising grandchildren and trying to make sure that they have the right health care coverage for the grandchildren. It's issues with pensions, and maybe they've had some trouble obtaining a pension that they were eligible for. And you can see some of the outline there. Georgia Cares, that is where we house most of our health information counseling services. And again, this is done by volunteers across the state. We provide training. CMS provides training to the volunteers on health insurance, long-term care insurance, Medicare, Part D, Part A, B, C, and we provide enrollment services. So if an individual needs assistance enrolling for the Medicare, they can go to the SHIP volunteers and they'll get that assistance. We also provide access and connections to the prescription drug assistance programs. Senior Medicare Patrol is a fraud component of the Georgia Cares, and we work with CMS and providing training to older adults to recognize when they've been a victim of fraudulent billing in Medicare. Also provide a lot of education to older adults on the Medicare program. And then, as I mentioned, I wanted to say for last, our Aging and Disability Resource Centers. This is an area that we see as kind of one of the areas or the future of aging services, and that's the information and access to services. Knowing that we only provide services to between 5 and 10% of older adults who need our level of service, but there's a lot of people who are new to aging. As a society, we've not experienced this amount of aging before. And the systems are all messy. They're difficult to navigate. And the ADRCs, we try to build them such that you can go there and they'll assist you throughout the entire process, whatever that might be. We work very closely with the DD Disability Affairs. We work a lot with independent living centers and our local community providers to make sure that people have access to everything they need. And we just won last week a national award for our development of ADRCs. I wanted to share that. Outstanding achievement in state changing systems by a state. That was, we were competing against about 40 other states who also have ADRCs, fully functioning ADRCs. And we were recognized by CMS, Centers for Medicare and Medicaid Services, Administration on Aging, and the VA, because we also are moving into providing services to veterans as they want to remain in home and in the community. And the very last slide, as I mentioned, is our 1866 number, our gateway to aging services. No matter where you are, if you're out of state, you can still call the number, and we'll get you to the right ADRC.
You want to repeat that number one more time?
866-55-AGING. And I remember that much easier than 866-552-4464. But that is the actual number.
But anyway, I just wanted to make sure that those in the audience were aware of that number if they weren't already aware. Wanted to ask you in regards to the legal assistance that is provided by our department. I would like to suggest that you just sort of be aware of that House Bill 278, the Georgia Health Care Directive, and just be a part of that discussion, please, as it goes forward in the next few days or next week or so, to have your input as to the protection also that could be involved there. I know that you mentioned the aspect of the end-of-life decision, and I can't stress enough to everyone that you have a living will, that you have the powers of attorney set forth before you become of some point in your life that you can't make those decisions, go ahead and make them now. That is not a negative thing to do. It is a very positive thing to do for your care. And, of course, the Georgia Health Care Directive is also very important. So I'm stressing that to everyone. If they don't have a living will, that you need to at least go that avenue along with your power of attorneys, because there's too many folks that are left here with no decision or no directive for the remaining of the days that they may have here on earth. So I wanted to state that and make sure that you're in attendance to those discussions also. With that, do I have other questions from our committee members? How about any questions from those in the audience? We've got the agency here that can answer those questions for all of us. If not, you see the faces that are very important to us. You've got the wonderful phone number that we keep repeating to you that you can call and communicate, and they are available. And it's not where you're going to get the answering machine. It is a person at the other end of the line, and that's a very positive thing in my mind. So feel free to give them a call. Feel free to call us. I want to apologize that we didn't have the screen. We had it available, but we could not ever get the PowerPoint from the laptop working so that we could put it up for everyone to see. So we do have some handouts that we can certainly make copies if any of you would like to have a copy of that. And I see Reverend Dee's back there that, no, I see Miss Daisy's daughter back there, and she's going to be wanting some. So we will make some copies, and they will be in my office in 401 at the Capitol. And also, I want to thank you for coming here today and helping us have a better understanding of our department and what you do. And I don't know, Ms. Stars, if you might have some questions that you might want to address us with, or even a statement. And I would also like for us to pass out to those members that are here the packet so that we can have those to look at. And we will be asking you to come back and chat with us on the other programs, in particular that in the avenue of abuse. And I want to go ahead, please.
In the package, you'll have actually a handout that will allow you to order. You had mentioned advanced directives. There is actually a state legal services developer who develops outreach materials for the public so that they're user-friendly. So they're actually the forms and things where people can order. Sometimes even your legislative offices will want to. And at that 1-866 number, you could actually order some of the advanced directive forms and everything.
Well, we want to thank you so much for taking the time to share with us the information that you have this morning. I think it's been very enlightening to us, as well as maybe many in our audience. And thank you so much, and I shall be talking with you in regards to that. Also, I would like to recognize some folks from my home that are here this morning, and they got up and made it over here to the Capitol at a little after 8 this morning. And if you will stand and let me recognize our Coastal Georgia senior citizens, and many from the Effingham County area. I certainly thank you for being here. As you know, this week is our Georgia Seniors Week here at the state capitol. We are expecting each of our days this week anywhere from 200 to 300 of our senior citizen associations coming and being a part of the legislative process. And by being a part, I want you folks to know one thing. As I was standing talking with them, they had all these questions about this House bill, that Senate bill. It's fantastic to see that our communities are so involved in the legislative process, and we don't mind speaking out. So I want to thank you all for being here today. And if I missed anyone, if there's just senior citizens here that wasn't from the coastal area, how about you standing? I don't want to miss anybody. Fantastic. Well, I appreciate you being here. I want to also thank the committee members, and I want to thank our committee assistants that have come with legal counsel, as well as our committee aides for being here this morning. But I want to say a special thank you to our committee members. As you know, we do a roll call. Attendance is kept with our committee. Occasionally we know that we have other things that are going on, committee meetings, that make us where we cannot attend, but most of you will drop in. Let me say to you again, thank you, because we have to have a quorum of 4 here in order to have any votes during our meeting times, and I just want to reestablish that adoption of rules that we had that's in the front of your folders. Wanted to also just talk with our committee very briefly. I'm very excited about an event that we're fixing to have, and we have had several of our healthcare groups to come together and to say that they would sponsor an event for our committee. And I think it's a very exciting thing in my mind, and I hope that you will feel the same way. This event will be held on March the 10th. Please put that on your calendars for the committee members. I will need to know as soon as possible if you will be in attendance for the committee members, because of the fact where we're going only has seating for 16 people. They are going to be opening the exhibit for us, and we will have a 4-course dinner. Now, what's so great about that, because committees go out, but ladies and gentlemen, we are going to have a dialogue in the dark. We are going to Atlantic Station, where the dialogue in the dark is located. As I said, they will be opening for us. I have found out who the chef will be that will be cooking, and that is a gentleman from Rosebud. And he said, you know, what do you want? I said, good Southern cooking. So, but what's so special about that? It is where we will actually go in, and we will be a part of the darkness. What does that indicate? We will be led by the blind or someone with impaired vision. We will be in the dark for the entire event that evening, so that we on this committee can relate to the needs of those that experience the darkness. They will take us on a tour. They will be able to show us the various things by touch, chair is, the steps that you will take. At the end of that tour through the facility, then we will again, I understand, be served in the dark, where we will have dialogue continued in the dark, and will be served and told what we're eating and how we are going to be eating it. What better way for this human relations and aging to experience something that some of our individuals throughout the state, and blindness as any other thing, doesn't have any consideration for age. Many may be born with that disease. Others may have inherited. I've just had a first cousin that has been an accountant, and within the last year and a half, he has been declared legally blind. And, you know, experiencing talking with him, he lives in Kentucky, and when I talked with him last Sunday and I told him what we were doing, he applauded us on the phone for taking the time to experience what others may have to experience. He also told me, you need to come see me real soon because I want to see you. So, and I laughed and I said, he said, oh, I will. I'll see you. So I'm excited about this. I have got the forms so that you can see what we're going to be doing that night. But please, to the committee members, let me know if you can attend, because we only have the very few spaces. They only seat 16. So the time is going to be 6:15. We need to arrive at the facility outside. Our tour through the exhibition will begin at 6:30, and it will be around 7:15 when we should sit down for supper. And it's March the 10th, and I will be giving you some additional information, but I just need to know your RSVP. So we are going to be a working committee. We will be taken to supper, but we're going to experience what things are all about within this avenue of blindness or not being able to see totally. So it will be a dialogue in the dark. And with that, is anyone else that would like to speak to our committee, or any House member that wishes to bring information to us? Before this committee, we do have House Bill 226 as well as House Bill 278. Both of those will be brought before our committee for discussion and possible vote. Just wanted you to be aware that those two House bills have been assigned to our committee. With that, this meeting stands adjourned. And let me share with you.